Marketing and Donor Relations at the Blood Transfusion Service. That's Mr. Titus Shivute. A very good evening to you, Mr. Shivute, and thank you so much for being here with us.
Good evening. Thanks a lot for having me.
Now, you've kicked off, or you've kick-started off your campaign for this festive season on the 15th of this month. What do you hope to achieve during this campaign?
Thanks a lot. Well, there are various objectives with this campaign. The key one being obviously for us to have sufficient blood and blood products for all patients who require it in various medical centers as well as hospitals around the country.
Right.
So we are basically embarking on this campaign for the next 6 weeks up until the end of December to try and generate sufficient units over that festive period for individuals to be able to receive blood in our hospitals. So the main aim and objective now for this campaign is for us to basically collect close to 5,000 units of blood. That basically would entail 5,000 individuals donating blood in between now and the end of December to help ensure that lives are saved at a time when emergency situations increase in our hospitals around the country.
So Namibia experiences quite a lot of accidents, motor vehicle accidents during the festive seasons. Are there plans in place to distribute the blood across the country for easy access and quicker responses?
Yes, there are plans in place. We work very closely with the National Institute of Pathology in basically availing blood and blood products for all patients who require them. We also distribute to over 50 hospitals and medical centers around the country, which are able to basically do transfusions to various patients. So the plan is now leading up to the festive season for us to basically create a sufficient buffer in terms of blood stock to help ensure that all of these hospitals actually have these units in place already should there be any emergency cases that for which patients require blood.
Well, which brings me to the next question. What is the current status of the blood bank?
Okay. We've observed shortages earlier on in the year, but I am happy to say that we are currently experiencing a moderate supply of blood in our hospitals and medical centers in the country. But we do envisage that there will be a drop in terms of our current blood stock. So what we currently have in stock is what we refer to as a 10-day blood stock. What that basically means is that we have sufficient blood for the next 10 days if no further collections or donations are made, and the ideal blood stock level will be a 9 to 12-day blood stock level. But with the festive season, we have synonymously experienced that there is a drop in terms of donations around the country because Windhoek, which basically forms as the hub for donations and collections for the entire country, is basically empty during the festive seasons.
Right.
And then donations also drop because individuals generally do not donate blood in and around the festive season. So we are trying to now basically collect sufficient donations leading up to the festive season to help ensure that no lives are lost as a result to no sufficient blood and blood products for patients.
Are you able to tell us which blood types or which blood type levels are currently running dry, and how are you encouraging people with those blood types to come and donate blood?
Okay. Yes, there are 8 different blood types. The blood types that are currently in demand are the O blood types, which is your O positive as well as O negative. Now, there are various reasons for this. First and foremost, because the O blood type is compatible with other blood types. So what that means is that your O blood type can be administered to patients of any other blood type.
Right.
So as a result, it's the one that's used up the most, and it's also the ones that's transfused in emergency situations. So we are urging more individuals with that blood type to donate blood. Currently, what we have in place are various recruiting tools to try and get all blood donors to also donate if we have found out that they have those blood types. So with all the various blood drives that we are currently doing, we actually are calling these individuals via our customer care center. We are also sending out SMS invitations, and we are also helping spread the word through social media and platforms such as this daily roundup in order to sensitize all individuals with the O blood type to please donate blood and help ensure that lives are saved.
one of the things that I've noticed is that many people don't know what their blood type is. Is there such a service where people can just go and find out, or do they only find out at the time that they are donating blood?
Yes, there are actually platforms where you can totally find out your blood type for free. We opened a new center within the CBD area at the Channel Life building, and that center is open every Monday to Friday, but each and every Thursday we actually offer free blood group testing, where any individual can basically walk in, just do a quick finger prick test, and you can get to find out what your blood type is and gain more information on your blood type as well, to help sensitize more individuals about blood types in Namibia.
Right. And apart from donating blood, we understand that people can also donate plasma and platelets. Briefly talk to us about that and its importance, as well as what these two substances are used for.
Okay. Well, there are various components within your blood. Your blood basically carries red cells, platelets, as well as plasma. So in order to basically extract plasma, we needed to come up with a donation system in place so that individuals can specifically donate one component, and then the other components that are not required within that donation will be returned to your body. So what happens with the apheresis blood donation that only takes place at our head office in 35 Dal Street, Osman Plus, is we actually do apheresis blood donations, which basically means that we do a donation to separate your red cells via a needle incision, and then your red cells are returned back to your body in the same incision. So it's a lengthier process, and for that you actually would need for us to test, to do a full blood count to determine the number of plasma cells as well as platelet cells within your body right before you are able to donate. And it's a lengthier donation, as I mentioned, because sometimes you can even sit on the bed for about 90 minutes for platelets. And then for individuals who donate plasma, which is the component the component that basically carries a lot of essential nutrients within your blood, you're also able to do that within 20 minutes. So we really encourage all individuals to visit our various centers. We also try to create a very comfortable environment, really dedicated staff members who are really friendly to help ensure that the process is as safe as possible for you, the blood donor, and at the end of the day, the patient who receives your blood.
So this is a countrywide campaign. Which are your main areas of focus, and should people only donate as these setups, or can they come to your office in Tal Street as well?
Okay. We have various centers around the country where you can generally walk in, no need to make appointments. So the first center that individuals can donate at is our head office in 35 Dal Street. We are open from 7 in the morning up until 4 o'clock every afternoon. And then on Tuesdays and Thursdays, we offer extended hours up until 6 o'clock in the evening for individuals who are unable to donate during the course of the day. Then we have the Channel Life Center in Post Street Mall. That's also open every Monday to Friday between 8:30 in the morning up until 4 o'clock. And we also host blood drives all over the country. For our residents in Swakopmund, we have a center in Swakopmund that's only open on Mondays. It's located in 4th Ferdinand Tick Street, right across the Cancer Association. And that center is open from 10 in the morning up until 6 o'clock. And then for all our residents in Wolfish Bay, they can also donate at our Wolfish Bay Center located behind the Velvicia Medipark between 10 o'clock every Tuesday up until 6 o'clock that evening. And then there are 2 more centers where they can also, individuals can also just walk in and donate. And these centers are located in Ondangwa as well as Oshakati. So in Ondangwa, we actually have a brand new center that opened up that's located in Washamba Mall. So we have an outlet within Washamba Mall where anyone in Ondangwa can donate. And for all our residents in Oshakati, they can donate at the Oshakati State Hospital Center. We also have blood drives that are basically going to be hosted at, across various towns, because we do mobile blood drives where we go to various locations. Right. This week we've been in Ochivarongo and Ocho. Next week, Tuesday, we'll be in Omaruru, and then on Monday we'll be in Karibib. We are also going to be in Usakos next week, Thursday, and then we also have blood drives planned for Tsumeb as well as Grootfontein. So with Tsumeb, will be in Tsumeb on the 28th of November, and then in Grootfontein towards the 2nd of December. And then we also have blood drives in Gobabis planned for from the 5th to the 7th of December, as well as Keetmanshoop Mariental between the 12th to the 16th of December, and then Okahanja on the 13th. But I also just need to emphasize that we have various mobile teams within the coastal region that will be doing blood drives at various locations throughout the entire festive season. So if you see us setting up at June's Mall, or you see us setting up at Plaza Mir, or even in Oshakati at Game or Marula Mall or wherever, you can also make a blood donation in any of those venues as well.
Well, let me thank you so much, Mr. Shivute, for speaking to us, and we certainly hope that the public is going to heed your call and go to one of these centers and donate blood.
Thanks a lot for your time. Hopefully we'll get to see you donating blood as well soon.
Thank you so much. Of course, the Supervisor for Marketing and Donor Relations at the Namibia Blood Transfusion Service at Titus Shivute. So do heed that call and go and donate blood. It's much needed for this festive season. Well,